Today we're taking a deep dive into a pill that has totally reshaped what focus means for millions of people. You probably know it by its brand names, right? Ritalin or Concerta. We're going to break down how it works, what the risks are, and get into the huge debate it sparked in our society.
It's a fantastic question, isn't it? And answering it takes us right into the fascinating chemistry of our own brains. So, let's start at the beginning. What exactly is this stuff, and how on earth does it do what it does?
All right, first things first. Let's get to know this medication by its actual name.
So methylphenidate is what's called a central nervous system stimulant. It's mainly prescribed for attention deficit/hyperactivity disorder, ADHD. And sometimes it's used to help people with narcolepsy, which is a sleep disorder. The really important thing to remember here is that it's not a cure. Think of it more like a tool, one that helps manage symptoms.
Okay, so how does this little pill actually, rewire our ability to focus? Well, the magic happens with these tiny microscopic messengers and gatekeepers that are already inside our brains.
I want you to picture your brain as this giant, super busy communication network. To send a message about something like motivation or focus, one brain cell, a neuron, releases a chemical messenger called dopamine. That dopamine zips across a tiny gap to the next neuron and delivers the signal. Now, once that message is received, special proteins act like this little cleanup crew, swooping in to vacuum up any leftover dopamine. It's an incredibly efficient system, really.
And right there, that's where methylphenidate steps in. It basically puts a stop sign up for that cleanup crew. It acts like a gatekeeper, blocking the proteins that are supposed to reabsorb the dopamine and another key messenger called norepinephrine. It just stops them from clearing the area.
So the key takeaway here is that the drug doesn't actually create new dopamine. It just lets the dopamine your brain already made hang out in that communication gap for a lot longer. And this is exactly what it means to turn up the volume and the clarity of the signal. It's kind of fascinating, because here's the paradox. By stimulating and amplifying these specific pathways for focus, the medication can actually have a calming effect on a brain that's struggling with ADHD. It lets it filter out all the noise and just concentrate.
So if the signal is now louder and clearer, what does that actually look like in the real world? Well, for someone with ADHD, the effects can be absolutely massive.
We're talking about the ability to stay on task, to actually think before acting, and to keep your thoughts from flying all over the place. And look, these aren't just little tweaks. For a lot of people, this leads to better grades in school, more success at work, and just smoother relationships with people. It can be genuinely life-changing.
Of course, to make this work consistently, the technology had to evolve. The original Ritalin was what you call immediate release, and it only lasted for a few hours. That meant you had to take multiple doses a day, which created these distracting ups and downs. So to fix that, they developed extended release versions like Concerta, designed to give a steady, smooth effect that can last an entire school or workday.
But a tool this powerful always has another side to it. So now we have to talk about the other edge of the sword, the pretty significant risks and warnings that come with it.
So on one side, you've got the common side effects that are often manageable. Things like headaches, having a hard time sleeping, maybe not feeling as hungry. But on the other side, there are much more serious, though thankfully less common, psychiatric risks. For some people, it can actually make conditions like psychosis worse, or even trigger manic symptoms and paranoia.
And look, the warnings do not get any more serious than this one. The FDA put its strongest possible caution on this class of medication. It's called a black box warning. And it's there to highlight a risk of sudden death in patients who already have serious heart problems. This is exactly why a really thorough heart evaluation is so important before anyone starts this treatment.
Because of these really powerful effects, and let's be honest, its potential for abuse and dependence, methylphenidate is classified as a Schedule II controlled substance here in the US. Now, to give you some context, that puts it in the exact same legal category as potent opioids. And that means the rules for prescribing it are incredibly strict.
And that brings us out of the world of brain chemistry and into the much bigger conversation, the societal and ethical questions that pop up around a medication that can so directly affect our focus and performance.
And these debates get really complex, really fast. Are we overdiagnosing ADHD in kids who are just really active, or are we still underdiagnosing it in adults, especially women? And then there's the whole enhancement question. What are the ethics of using these drugs not to treat a disorder, but just to get an edge, to improve already normal performance? Some people call that cosmetic pharmacology, like getting a brain boost instead of a medical treatment. And of course, there's the stigma and the very real pressure some students feel to misuse it just to stay competitive.
So we'll leave you with this central question. Where do we draw the line? Is methylphenidate strictly a medical tool for a diagnosed disorder? Is it a performance enhancer for an increasingly competitive world? Or is it, in reality, becoming both? That's a question that science, ethics, and all of us in society are going to be grappling with for a long time to come.